Every 7 minutes, someone in the United States dies from a drug most people have never seen. Synthetic opioids are now the leading cause of overdose deaths in America. Most of the victims never intended to take fentanyl. It doesn't always look like addiction. Sometimes it looks like a teenager in a quiet bedroom. Sometimes it looks like a college student at a party. Sometimes it looks like someone who thought they were taking something else. This isn't just a drug crisis. It's a supply chain of death. Fentanyl was never designed to destroy communities. It was developed as a powerful medical painkiller, used in surgeries, used in cancer treatment, used to manage extreme pain. In hospitals, it saves lives. But fentanyl is not like other opioids. It is 50 to 100 times stronger than morphine. 2 milligrams. That's enough to kill. A dose smaller than a few grains of salt. But the fentanyl killing Americans isn't coming from hospitals. In recent years, chemical precursor ingredients have been manufactured and shipped across borders. Some originate in places like China. They are transported, processed, and synthesized by criminal organizations, including cartels operating in Mexico. In hidden labs, fentanyl is pressed into pills, made to look like legitimate prescription medication. Oxycodone, Xanax, Adderall, nearly identical, nearly impossible to tell apart without testing. Because fentanyl is synthetic, it doesn't require poppy fields. It doesn't depend on harvest cycles. It is cheap, portable, extremely potent, and easy to conceal. You don't have to look for fentanyl. It finds you. Long before fentanyl flooded the streets, America was already facing an opioid crisis. In the 1990s, pharmaceutical companies promoted prescription painkillers aggressively. Among them was Purdue Pharma. Opioids like OxyContin were marketed as safe and effective for chronic pain. Prescriptions surged. Dependency quietly followed. What began as pain management turned into widespread addiction. Communities were already vulnerable. Before fentanyl flooded the streets, addiction was already rising. Heroin varies in strength. Prescription pills are measured. Fentanyl on the street has no quality control, no regulation, no consistency. It is often mixed into heroin, mixed into cocaine, pressed into counterfeit pills. Sometimes the user doesn't even know it's there. It's cheap to produce, highly profitable, and deadly in microscopic amounts. It's not just affecting addicts. It's affecting teenagers, first-time users, party drugs, people experimenting once, people who never thought they were at risk. And with fentanyl, there may not be a second chance. Overdose deaths in America have risen dramatically over the past decade. Synthetic opioids now account for the majority of those deaths. The COVID-19 pandemic accelerated the trend. Isolation, anxiety, economic instability, more vulnerability. Ambulances became more common. Memorial candles became more frequent. This is the deadliest drug crisis in American history, and it is still unfolding. A 17-year-old high school student. Good grades. Friends. Plans for college. One night, he buys a pill he believes is Xanax. He takes it alone in his room. His parents think he's asleep. They knock. No answer. They knock again. Still silence. It only takes once. The pill was counterfeit. It contained fentanyl. By the time help arrived, it was too late. There was no history of addiction. No warning signs. Just one pill. And one irreversible moment. Paramedics and police officers now carry naloxone, often known as Narcan. It can reverse an opioid overdose in minutes by blocking opioid receptors in the brain. In many cases, it brings someone back from the edge of death. But sometimes one dose isn't enough. Sometimes it takes 2 or 3. Schools stock it. Libraries carry it. Parents keep it at home. It has saved thousands of lives. But it is not a cure. It is an emergency response. A second chance. The fentanyl crisis has sparked heated debate. Some argue stronger border enforcement is essential. Others emphasize harm reduction strategies, safe injection sites, expanded treatment programs, public health investment, law enforcement efforts. There is no single solution. The crisis intersects with addiction, mental health, poverty, and organized crime. It is complex and deeply human. The dealer isn't on a corner anymore. He's in your child's phone. Encrypted messaging apps, private accounts, emoji codes, pills advertised like products. Transactions happen in minutes. Delivery sometimes within hours. Teenagers can access drugs without ever leaving home. The digital world has made distribution faster, harder to detect, and more anonymous. Fentanyl is cheap to manufacture. It requires no farmland, No seasonal growth. Small quantities generate enormous profit. It is easy to transport, easy to conceal. High potency means higher return per gram. For criminal networks, it is efficient. For communities, it is devastating. A business model built on addiction. The impact extends beyond overdose statistics. Children entering foster care, families fractured, emergency rooms overwhelmed, mental health systems strained, homelessness rising in some regions, communities grieving quietly, empty playgrounds, unfinished futures, no region untouched. Despite the devastation, there are stories of recovery, rehabilitation centers, support meetings, families advocating for awareness, former addicts helping others rebuild. Addiction is powerful, but so is recovery. Treatment access is expanding in some areas. Education campaigns are growing. Community outreach is increasing. The crisis is severe, but it is not beyond response. The fentanyl crisis didn't appear overnight. It was built by demand, by profit, by silence. It evolved from prescription pills to synthetic chemicals to counterfeit tablets in a teenager's hand. This is not a distant issue. It is in neighborhoods, schools, homes. Ambulances still respond. Phones still buzz unanswered. Families still wait for doors to open. And unless the chain is broken, the next knock on the door could be yours.